Good evening and welcome to our COVID-19 update. I'm Ladi Akiridoluale here at the highlights at this hour. Presidential Task Force says Nigerians should expect locally made COVID-19 test kits soon. Confirms that it is undergoing a validation process. Federal government promises a better experience for international travelers as it upgrades the travel portal. And global COVID-19 death toll surpasses 1 million. We start off in Abuja and the Presidential Task Force on COVID-19 briefing, which took place earlier on today. Nigeria is putting up a strong fight against the COVID-19 virus in partnership with world-recognized organizations and developed nations. The Secretary to the Government of the Federation and Chairman of the Task Force, Mr. Boss Mustafa, explains that government is in partnership with the World Health Organization to achieve a rapid test kit for use by Nigerians. Mr. Mustafa was speaking in Abuja.
Continues to partner with the WHO and shall certainly be part of the early beneficiaries of the rollout when it commences. Nigeria is also contributing to the global effort in the diagnosis of COVID-19 through our research institutes, led by the Nigeria Institute for Medical Research. The PTF will be updating you as we make progress in this particular discovery. We note with sadness that the global community just crossed an unenviable milestone when COVID-19 related fatalities surpassed the 1 million mark. It has taken only 8 months for over 33 million persons to be infected and 1 million fatalities to be recorded in almost all countries and territories of the world. These numbers underscore the seriousness of the pandemic and should help to determine how not to lower our guard.
Meanwhile, with the reopening of airports, businesses and schools in the country, it's become more important to come up with proactive and innovative ways of combating COVID-19. And that's according to the Minister of State for Health, Dr. Olorunimbe Mamora. He says this stride has been achieved, in fact, by the Nigerian Institute of Medical Research with a molecular test that can produce results in less than 40 minutes. The minister said this would help with ramping up testing in the country.
As business and schools begin to open and as travels begin to pick up, we fear that we may have a surge in the number of cases unless we scale up surveillance and review our response plan to integrate new ways to deal with the disease. In line with this, the Nigeria Institute of Medical Research has developed a molecular test for COVID-19 that can give results in less than 40 minutes. It is the SARS-CoV-2 isothermal molecular assay, SIMA, which can be performed by low-skilled personnel with minimum training. The rollout will be very soon, as announced by the chairman of the PTF. This test, which is 10 times cheaper than the PCR, can be deployed for point-of-care detection and surveillance.
Meanwhile, the Director General of the Nigeria Center for Disease Control, the NCDC, says Nigeria is embarking more vigorously on public sector testing across the country.
We have made a commitment as a government to make sure public sector testing is free for everyone throughout this outbreak. Most public health tests in Nigeria previously, whether it's been Lassa, yellow fever, monkeypox, whatever we've been testing for, where there's a threat to the public, the test has always been free. And so the government of Nigeria has worked very hard to ensure that our public sector testing is free. But the test in itself is not free. Remember, somebody's paying. Somebody is always paying. So the government of Nigeria has made a decision to prioritize the public and to make sure that we enable this test to be available for everyone that needs it in the public sector. We cannot compromise that for people traveling. Travel is a choice. So if you do want to travel, you have to pay for that test on arrival. And none of those funds, not a single dime, comes to NCDC or any federal government parastatal, ministry, agency, or the PTF. This goes directly to funding the test itself in each state, with a small percentage going to the state government negotiated for overheads.
And staying with the PTF briefing, where the national coordinator, Dr. Sanya Liu, is appealing to Nigerians who have experienced some challenges with the international travel portal to bear with the system as they work around the clock to upgrade the digital network. Dr. Liu explained that over 27,000 international travelers have passed through the Nigerian airports since they reopened, and a few of that figure have witnessed hiccups during registration.
Of the 27,000 plus passengers, 99.8% of them had a negative COVID-19 PCR result. The majority, specifically 85%, had no issues with payment on the portal. Of the 15% that had issues with payment, this was resolved in 12% on arrival. So it is correct to say that of the 27,000 coming into the country, the majority seamlessly went through the registration, the entry, and the retesting process. However, with an operation of this scope and scale, there are bound to be issues that will arise. This is an IT system. It's not perfect. We are humans. Talk less of computers. And especially with a travel portal that is relatively new. We didn't even trial this travel portal. We had to immediately implement it because of the pressure for opening the international airports. Without the travel portal, we probably would still have been struggling to open up the international airports safely.
Moving on to schools reopening, and following the rescheduling of that in Edo State as a result of the then proposed labor strike, the government and teachers are encouraging parents to bring their children to school for the first term of the new resumption date of Tuesday, October the 6th. While putting the schools and indeed the materials in place in line with COVID-19 protocols after weeks of training for head teachers and teachers on the guidelines, the government says it is also set to distribute free textbooks, homework books, and other learning materials to all the pupils and students in the basic section of public schools.
Nestled in the streets in the GRA of Benin City, the Edo State capital, is Family Support Program FSP Primary School, one of the public schools in the state preparing to welcome pupils after the 6-month COVID-19 necessitated break. From classroom to the fields, arrangements for resumption are ongoing.
Basket for waste bin, bucket that has a running tap, then the washing hand soap were all provided for us, which they are also in strategic positions in the school.
Emutan Primary School is another public school also in Benin City outside the GRA. The teachers are on the ground here as well.
My message to the parents is to tell their ones to come to school on the 6th of October. And when they are coming, all should come with their face masks. And they should wash their hands at the entry point before entering the compound.
While the schools work towards reuniting with their pupils, the parents also share their plans and concerns.
I will give them face masks, hand sanitizer, and I also make sure I go to the school to know if there will be social distance in the school.
As long as the school take the necessary precautions, hand sanitizer, face masks, and also to not rolling out the place of God also too in protecting our kids in school. So I'm not scared. I think it will be safe for them to go back to school.
It's a good idea, but they should check the private schools. That is my concern. If they will be complying.
The government had previously assured parents that it had engaged private schools proprietors in its plans to keep staff and pupils safe with a monitoring system in place. But apart from the COVID-19 protocols, the state government, with support from the federal government, also has plans focused on teaching and learning. The storage areas here hold some free textbooks and instructional materials, which the chairperson of the Edo State Universal Basic Education Board, Joan Oviawe, has come to inspect before they are distributed.
For this term, we're going to be distributing over 600,000 books and instructional materials, and as well as mobile science kits and mathematics sets for the junior schools. So the books here range from ECCD, which is kindergarten, all the way to GSS 3. And it covers the full spectrum of our subjects in each, across all the grade levels.
She also explains that the materials, just like the COVID-19 prevention measures, would reach all the schools in the rural and urban areas. Jessica Oluguse, Channels Television News.
The Katsina State government has directed all public and private primary and secondary schools in that state to reopen on October the 5th, 2020. This is coming as the state, as of Tuesday, had recorded 859 confirmed cases of COVID-19, discharged 835 patients, and recorded 24 deaths with 0 patients on admission. Its Commissioner for Education, Professor Badamasi Charanchi, says the second term for the approved adjusted school reopening calendar will begin on Monday, the 5th of October, and close on the 23rd of October 2020. That's 3 weeks. According to him, the third term will start on Monday, the 26th of October, and close on Friday, the 5th of February 2021. That's 15 weeks. During the resumption period, all schools are expected to be operating on shift, except when students are few, with those always encouraged to wear face masks, maintain social distancing, as well as other safety protocols. With the COVID-19 pandemic, the volume of medical waste has quickly risen as of questions of proper disposal and waste laborers' working conditions. The massive production of medical waste aligns with the increasing demand for medical masks as well as other self-protection equipment in the midst of COVID-19. In addition, the use of medical masks is also necessary for any person having symptoms of COVID-19 in order to minimize transmission possibilities to healthy people. This becomes all the more reason why medical waste should be handled seriously, since it is different from domestic and household waste. To tell us more about the handling of COVID-19 medical waste, I'm now being joined by Mr. Ola Oresoya, a waste management expert, the special advisor to the Ogun State Governor on the environment. Mr. Oresoya, thank you for your time. Welcome to the program.
Thank you very much.
Let's talk a little bit about medical waste, particularly as it relates to COVID-19. How much of an increase have you noticed in terms of the amount of medical waste being generated since we were visited by this pandemic?
Well, generally there's been an increase, like you mentioned, in waste generated during the COVID-19 lockdown. From almost a record, which I can give, I think we have about 65% increase in waste generated. Most of them healthcare waste and domestic waste, because people consume more during that period. And generally, just like you said, even at household level, you now have issues of masks and gloves and gowns and several other PPE that we now start seeing in the household waste. And also, the single-use plastic also increased during that period. So there's a general increase generally in waste generated during the pandemic.
How are we supposed to get rid of this waste? So many people don't seem to know that disposal of medical waste is quite different, as we pointed out, from household or domestic waste.
Oh, I think what we need at this time is education, and and that starts from the healthcare itself, and healthcare basically from the healthcare centers, and also at household level, because you now see that this healthcare waste is not just from the health institutions now; they're also coming from homes. So we need to be conscious of this, and separation is the first thing you have to do. You have to separate these waste and make sure that even at hospital levels, because you have a poor storage facilities at most hospitals, separation of these waste, you don't get to see them in many of the hospitals. In the study we carried out recently, only about 35% of hospitals are separating their waste. Most of the waste are commingled, and this makes it more dangerous for those who are providing the waste management services for all these healthcare institutions. And also in household level right now, there's a slight increase, about a 5 to 10% increase in healthcare waste in domestic dustbins. And all these things get mingled with this in a dustbin right now. So there's a level of education we now have to introduce to healthcare workers primarily, and also to households, so that our education on waste management have to include hazardous waste management from household. Right now, we are seeing more of this hazardous waste from household. And you will know that this is a major threat. This is a secondary transmission source for these diseases. And this is a threat to the curve that we are actually lowering right now. And we need to be very conscious of this, because many people are no more visiting the hospitals. They are treating themselves at home. So self-medication at home is increasing. And people are generating this. They are no more reporting for testing right now. And this is ongoing, and we need to be very, very careful. So a lot of information, we need to start passing this, and not restrict the information to hospitals alone. We need to make it wide and clear everywhere. People need to know.
How much of a problem do the personnel who do waste disposal themselves, how much danger or possible danger do you think they're exposed to? You're speaking to us this evening from Abeokuta, that's the Ogun State capital. From that background, how much danger do you think these people are exposed to? That is, the waste disposal staff themselves, those who do the disposing.
Well, it's clear that they're highly vulnerable. It's very clear that they're highly vulnerable. They're highly vulnerable. And that is why you will have seen that recently, I think just last week, a few days ago, we had this education awareness program that was created, both for the healthcare and the health providers, and also the waste managers in Ogun State. And you will have seen that Ogun State has taken a very, very serious step to make sure that the management of this waste actually is a major issue. For example, in Ogun State, before the COVID-19, the healthcare waste generation is about 50 cubic meter that you get on a daily basis, about 50 cubic meter. But during the pandemic, it increased by about 100%, about 100 cubic meter on a daily basis that you have, and that is a major threat. Also, household waste increased. All household waste in Ogun State now are regarded as hazardous, because most of the components now in those containers, they're hazardous, they're dangerous. They're dangerous. You now have contaminated masks, contaminated gloves right inside the dustbin. And beyond all the COVID-19, let me tell you one thing, is that a lot of people who normally will have gone to the hospital for their routine treatment, they now do self-medicine at home. You now see a lot of syringes, other diseases beyond just COVID-19, are now being done at household level. And a lot of quackery is increasing right now. Quackery is increasing. You now see people doing a lot of self-medication at home. So at the waste management level, it's a major, major threat. And that's why waste managers are at the forefront of this vulnerability right now. So a lot of education need to go right now, and I think the national government need to do this carefully so that we don't have a secondary level of threat. We need to call the secondary transmission potential from careless waste management. It's a major issue. And
thank you very much. Thank you very much, Mr. Oresoya. Mr. Ola Oresoya is the Special Advisor to the Ogun State Governor on the Environment, and we've been talking about proper disposal of medical waste during COVID-19. Thank you for your time. We'll take a break. When we come back, we'll talk about another perspective to medical waste treatment. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. While almost 50,000 people have recovered from COVID-19 in Nigeria, the country has recorded 3 more deaths in the last 24 hours, putting the total at 1,111. The NCDC reported 136 new cases from 12 states and the FCT within the same period. Lagos is leading with 71 cases, followed by Rivers, which recorded 23. Plateau had 12, Adamawa and Oyo 6, Kaduna recorded 5, 3 in both Abia and the FCT. Katsina and Kwara have 2 cases each, while Bauchi, Borno, and Edo have 1 case each. In the last 3 weeks, Nigeria has not reported any daily infection above 300, in fact, since August the 23rd. But then that was one of our highest cases, which was reported on July the 1st, when 790 cases were diagnosed. Let's talk to Professor Mariam Aminu, who is a virologist, and she joins us via Skype from Zaria in Kaduna State. Professor Aminu, thank you for your time. Welcome to the program.
Thank you for having me.
So many people are completely ignorant of medical waste. Nobody talks about it. Even general waste is a problem enough, but when you talk about medical waste, very few people talk about it. So I wanted to ask you, how much awareness do you think people have about the issue of medical waste and how it is to be disposed of properly, especially during this COVID-19?
Well, majority of the people that are aware of medical waste are those that are in the medical profession, because they are the ones that handle this waste. I think there is need for awareness, especially now. That one thing is that we should follow all the standard biological safety procedures concerning, especially now that we have COVID-19. All medical lab personnel should be trained on what to do concerning this disposal of medical waste, especially when
we seem to have a bit of difficulty with Professor Aminu's connection from Zaria in Kaduna State. We'll see if we can get her back, of course, but in the meantime, let's inform you that the much-awaited Aliko Dangote COVID-19 Isolation Center in Kano has finally been commissioned. During the ceremony, Governor Abdullahi Ganduje assured residents that the center will be properly managed in spite of the significant reduction in the reported cases of the virus across Kano State. Our correspondent Idris Jibrin reports that the center is now in the custody of the State Task Force on COVID-19.
Kano State was once the epicenter of COVID-19 pandemic in northern Nigeria and stayed with the 3rd highest number of cases in the country. 6 months ago, when the first few cases were confirmed in the country, states raced to build isolation centers and turn existing infrastructures such as laboratories to suit COVID-19 needs, while procuring scarce personal protective equipment for frontline workers. Yet all seemed inadequate.
There was fear that it could be the epicenter of coronavirus in Africa. But with the help of the federal government to give us 1 laboratory at Mala Aminu Kano Teaching Hospital, and then the mobile laboratory by CACOVID, and other development partners. Now we have 5 testing laboratories, we have flattened the curve of COVID-19 in Kano State.
The Dangote Isolation Center at the Sana Abacha Stadium is among the many interventions put in place towards stopping the spread of the COVID-19 pandemic in Kano, where deaths were already being reported from unexplained causes.
We have 2 mega wards, one dedicated for males and one dedicated for females, to ensure that whoever is admitted will be properly admitted and well managed in this facility.
The isolation center is part of the private sector-led response against COVID-19, providing facilities to help state governments deal with a new virus.
Each tent has a store and laundry with washing machine, one fully equipped laboratory, one X-ray scanning machine, ultrasound, and other biomedical equipment and consumable worth over 500 million.
These interventions might have helped Kano lessen the number of infections, as it has since slipped to number 11 on the list of the states with the most positive cases. Not a cause for celebration yet, according to the state government, which believes that now is the time to be cautious and not get carried away by the lower number of daily cases. Idris Jubrin, Channels Television News.
In Yobe State, the government, through its Sustainable Development Goals program, is empowering 850 vulnerable women across 17 local government areas in processing a local spaghetti to mitigate the effects of COVID-19. Making the symbolic presentation of the starter packs in Kash in Damagum, the headquarters of Fure Local Government Council, the coordinator of the SDG, Musa Salid Damagum, charged the beneficiaries to make good use of the opportunities provided.
We are trying to respond to the poverty gap that the state now faces at 62%, and then the state government is trying to come up with a response. We are hoping to expand to other local governments, but for now we targeted 50 women, 50 women in Fune local government. So we are still hoping to also expand to other local governments.
Honestly speaking, these women you are seeing here are the most vulnerable women in the community of Damagum, and that this gesture is going to cut across the local government. We are just flagging off in Damagum because of the fact that it is the local government headquarters of Fune local government. And Fune local government, being it the largest in the whole of Northeast, created since 1976 criteria, and that, of course, is going to cut across the local government, and the SDG is doing a well-done job. The Memala Buni administration is doing a well-done job. Buhari is also doing a well-done job.
I understand that Professor Miriam Aminu, the virologist who was speaking to us earlier, is back now on the telephone line this time from Zaria in Kaduna State. Professor Aminu, if you can hear me, we were talking about awareness and how much awareness needs to be developed for this issue of medical waste, and the fact that quite a number of people do not know anything about this.
Thank you so very much for having me. There is need, especially that individuals that are in charge of medical waste should be trained on how to handle this biosafety waste, because it's very, very important. Many people do not know that you have to autoclave and incinerate, especially when it comes to waste that have been generated with infectious disease like COVID-19. It is very, very important for infectious samples and highly infectious samples to be autoclaved first before being incinerated. We have to be sure that all our labs, all the medical facilities have incinerators. Because without incinerators, you cannot clear these infectious diseases. So it is important for the government to ensure that all the labs are they are all practicing the standard biological safety precautions, and then they are regularly training all their staff, and then they have to follow standard operating procedures. It's very, very important to create this awareness. People need to know how to dispose of these waste that are being generated from infectious disease labs. It is very, very important because not many people are aware of how to dispose of this waste. With COVID-19, they have to be autoclaved first. After autoclaving, then we have incineration, which is very, very important. There has to be training of staff and those that are involved, even those that transport these samples. It is very, very important that they are trained on how to take care of this waste.
What we know, you are not able to see the visuals that were on our screen now, but what we know is that most refuse that is generated in Nigeria, medical or otherwise, is simply taken to landfill sites and dumped there. And now you talk about special treatment for medical waste. Doesn't, for example, let's just take one type of this medical waste, that is the samples that have been collected from people in order to test whether or not they have COVID-19. What happens to those samples after the test results have been found out and sent to whoever it is that is concerned?
Thank you so very much for that question. Remember that these samples are tested. If they are tested and they are positive, or they are negative, they are supposed to be discarded. The first thing in any lab, any standard lab, what should be done is autoclave. All those samples that are negative, except if, for instance, they are positive and further result has to be done. Or maybe they want to do sequencing, they want to do further molecular studies, or do some particular sequencing, other tests. The samples should be kept at -70 until they are transported to the central lab. Otherwise, all the samples should be autoclaved and then incinerated. That is the standard procedure that infection, because COVID-19 is an infectious agent. So it has to be all the samples, everything that has to be done, that has to do with those samples, everything, including the gloves that have been used, have to be autoclaved and then incinerated. That is what that is needed to be, that is what has to be done when it comes to COVID-19. Many people do know. You don't just take them to the landfill and then discard, but you have to autoclave the samples first before you incinerate. That is what needs to be done with COVID-19 samples. And then those that you need, those that are positive, because we need to do some sequencing and do further research, should be stored at -70 for further use and be taken to the central lab, like the CDC lab.
Let me have a little bit of time to ask you this final question going forward. Do you think Nigeria is complying with what you've just described, broadly speaking? Do you think we're complying with it?
When it comes to COVID-19, from the COVID-19 research lab, I think they are doing that. But I'm not sure for other infectious diseases. With this side lab that we have around, you can't find it. It's not all the side labs that have incinerators. And that is one thing that is very, very important when it comes to disposal of this infectious waste. But now, because of the focus on COVID-19, all the labs we have, they have tried to produce the incinerators and the autoclave, but I am not sure of these other labs that we have around. But I'm advocating that the federal government to ensure that they monitor all these labs to ensure that they are doing the right thing. They should follow what is known as the standard operating procedure.
Indeed.
And then
thank you so very
lab
much.
That is working with COVID-19 should ensure that they use the biosafety laboratory type 3 to ensure that they minimize the aerosol that is generated from any of these infectious diseases. But the most important thing and what is key is that they should use autoclave first when it comes to COVID-19 and also use incineration.
Thank you so very much, Professor Miriam Aminu, for joining us first on Skype and then eventually by telephone from Zaria in Kaduna State. Thank you for your time this evening.
Thank you so very much. Thank you for having me.
Outside our shores, the United Kingdom today announced 7,143 new cases and 71 more COVID-related deaths. The cases are a daily record since mass testing began, but experts believe the figure were much higher in the spring. The daily deaths announcement was the highest since 1st of July when 97 deaths were confirmed, but hospital admissions fall in England for a fourth day in a row. Meanwhile, Prime Minister Boris Johnson has apologized and said he misspoke when asked to clarify details of new tighter COVID-19 restrictions in northeast England. A new rule making it illegal for households to mix indoors, including pubs, affects nearly 2 million people and comes into force at midnight. However, confusion arose over whether this included outdoor settings such as pub and beer gardens. Mr. Johnson is set to address the country in a press conference tomorrow. For more clarity on all of this, let's talk to our London correspondent, Juliana Olayinka. She joins us from the British capital. Good evening, Juliana. Nice to see you. What is this hubbub about, the whole issue of not being able to mix even with household members indoors? How complicated is this?
It is complicated, but I suppose in the next couple of minutes I'll try to make it a little bit more simple. I think it's fair to say that Boris Johnson and his government has had a rather tough couple of days. It's only been made even more difficult today after he had to apologise on Twitter for what he says was a misspeech, mixing up the rule of 6 with the new restriction that will come into the north of England from night to night, which will make it illegal for anybody to mix with members of different households. And I think that's the issue that the government have at the moment. It's all becoming very, very complicated. There are different lockdown restrictions for different regions of England, as well as for the 4 different nations across the United Kingdom. And at the beginning of the pandemic, things were simpler. It was to stay safe, stay at home and protect the NHS. Now that's much more complicated. And I think the main issue that the Prime Minister is having to face is really the livelihoods of the 15 million people that are currently in lockdown across certain parts of the UK. This particularly affects the hospitality sector. Last week, the Chancellor of the Exchequer scrapped his autumn budget for this new winter economic plan. He has a new scheme which will replace the furlough scheme at the end of October, but some say this isn't going enough. As you said correctly, tomorrow Prime Minister Boris Johnson will address the nation with his 2, some would call them partners in crime, Professor Chris Whitty and Sir Patrick Vallance. And there are some suggestions that perhaps Boris Johnson is going too far. The evidence is not good enough, is what MPs are saying, and people across Britain, they want to know exactly why, when, as you said, 7,000 people tested positive today, at the peak it was 100,000. So it's a massive difference, and yes, Boris Johnson is getting himself into a lot of trouble at the moment.
All of this, of course, is coming at a time that the country is battling, shall I say, other demons as well. There's the economic fallout of all of this, the question of people returning to or not going to work, and the job losses that all of that has brought about. And then, of course, there's Brexit. I remember the last time I spoke to you about this, you said it's all a pig's breakfast right now. So what exactly are they doing about this?
Well, in relation to Brexit, just about 30 minutes ago, MPs in the House of Commons just finished voting on the second reading of the Internal Market Bill, that piece of legislation, which, if it does pass through the House of Lords, will indeed break international protocol, international legislation and the treaties. Nobody's happy about this. This is a Northern Ireland protocol that will keep parts of Northern Ireland still within UK regulations. But Boris Johnson had such a long time to make sure that he had dotted his I's and crossed his T's that there are a lot of people wondering why he decided to do it at such a late stage. Of course, he does have a major Commons majority of 80 or so MPs, many MPs that disagreed with him. His own backbenchers, including former Prime Minister Theresa May, didn't vote this evening. She sustained, and people said that she did that because it would be historic for a former Prime Minister to vote against the sitting Prime Minister of her own party. But some would say it is shambolic. The British government has given themselves until the 15th of October to strike a deal with Brussels. Michael Gove, a senior cabinet minister, is in Brussels trying to see whether or not concessions can be made on both sides. But as you said, Britain does have a lot going on. And the issue that we have now, compared to other European countries, is that we have fared far worse. We went into lockdown a lot later. It's affected the economy a lot more. And we are expecting a tsunami of redundancies once that furlough scheme comes to an end in just about 5 or 6 weeks' time.
Going forward, of course, all of this is in the air, as it were. Let's put it that way. All of this is in the air. But there are quite a number of things that he's already made. He's already put his fingers to, and maybe there's some level of confusion. You and I discussed that this time last week when we were talking about the issue of schools, whether the young ones should wear masks or whether the older ones should or not. And then all that got into a bit of a shuffle because nobody knew exactly which was which. Is this because too many people speaking, for example? You've got, as you said, he and his partners in crime.
Well, of course, you know, it's not just Britain. This pandemic is facing the entire world, and leaders across the world are having to make these decisive decisions. But, you know, the facts are the facts. Britain is still the worst affected European country and one of the worst affected in the world. So something seems to be going wrong. Backbenchers were speaking to the Health Secretary, Matt Hancock, in the House of Commons yesterday, and they're now asking to push through a piece of legislation that will allow MPs to vote or debate some of these new measures that are coming in, because they do believe that the government is just giving too much free hand to scientific advisors that are going on national TV and are scaring individuals. But it's a good point you raised about education. Education has also been a major issue. Millions of students went back to university, some for the first year a couple of weeks ago. That has become an absolute shambles, must I say, with many of them testing positive. I believe there are about 860 positive COVID tests for university students on 46 universities across Britain. There were suggestions that they couldn't go home. They're being taught online. There are lots of hurdles that the government need to get themselves over. And unfortunately, when they go onto British media, they don't seem to be well briefed. And there are so many gaffes, like the one that Prime Minister Boris Johnson had earlier today, and he had to then go and apologise for it. If the Prime Minister of Britain doesn't know the rules on social distancing and lockdown restrictions, how can the community know the rules?
Good point, Juliana, good point. We're going to have to leave it there, I'm afraid. And, of course, we're going to keep an eye on this and check in with you as the week winds down to see what exactly everybody's going to make of this and if, indeed, at the end of the day, it turns out to be a success. Please keep safe out there.
Thank you.
Juliana Olayinka there. And let's talk about what's going on in other parts of the world. South African authorities say the country's economy has lost 2.2 million jobs in the second quarter of 2020 during the COVID-19 lockdown. It's been described as the biggest fall in job numbers since the unemployment survey began in 2008. The National Statistics Office figure for the number of people who have not been economically inactive indicated an even more dramatic economic decline. Meanwhile, global COVID-19 death toll has exceeded the 1 million mark, something the UN Secretary General Antonio Guterres says is mind-numbing. Here's a global update.
Medical resident interns took to the streets of Barcelona on Tuesday to demand for better salaries and working conditions amid the coronavirus emergency in Spain. They laid on the ground, blocking the roads in a symbol of their much-needed rest after long shifts and overworking. And hundreds of protesters gathered outside Israel's parliament on Tuesday, many angered by what they say are government's attempts to use lockdown measures to stifle demonstrations.
They're denying us of the right to protest because of political reasons, not for health reasons. And it's mind-blowing. It's the frustration is beyond words. Is beyond words, and great worry.
While the demonstrators took to the surrounding streets waving Israeli flags, banging on drums and chanting in favor of free speech, lawmakers inside advanced legislation that would limit their rights during a lockdown imposed to rein in surging COVID-19 infection rates. Meanwhile, Russia plans to share preliminary results of its COVID-19 vaccine trial based on the first 6 weeks of monitoring participants, raising the tempo in an already frenzied global race to end the pandemic. Alexander Ginsberg, head of the Gamaleya Institute that produced the Sputnik V vaccine, told Reuters that the pace of its development was necessary under the wartime conditions of a pandemic, but no corners were being cut. Finally, Australian defence personnel have been deployed to Port Hedland, one of the world's largest iron ore loading ports, to help contain a coronavirus outbreak on a bulk carrier that last changed crews in the major seafaring city of Manila. 17 of the 21 crew of the carrier have tested positive for the virus. Ship owner Ollendorff Carriers said in a statement that 12 crew members were moved to hotel quarantine, including 10 who tested positive, while 7 infected workers remain on board as part of an essential 9-person crew.
And indeed, that's where we wrap it up. That's our COVID-19 update for tonight. You can take a closer look at some of the stories and the numbers that you've heard tonight by visiting our website, channelstv.com. There all the updates and better understanding of all the stories, as well as what you need to do to stay safe during this period. And of course, there are other stories on politics, business, and sports. Thank you very much for watching. I'm Ladi Akiridulu. Good night.
Thank you.